Good afternoon, ladies and gentlemen. My name is Dr. Anish. I'm an intern who is in 16C. The case discussion is going to be on a 12-year-old with TOF, DVT, and osteomyelitis. The farm is Jeliffe with a team including palliative and hemonco. With the protocol observed, we kick off with the BIODATA. The name is WL. 12-year-old male, Catholic, Uganda. The next of kin is mother, TR. His education status is B5. Address is Kasanda, Bubende, approximately 3 hours from Mulago Hospital. Date of admission was 13/12/2019. The number of days he has spent on the ward is 2 months and 26 days. Presenting complaint, tetralogy of folate patient who was diagnosed 2 years on anti-failure regime, presented with severe pain, right hip for 1 week. History of presenting complaint, it's a gradual onset pain, non-radiating, worsened by movements, relieved by unknown injections given at the peripheral clinic. Onset was associated with a fall while walking on a separate road 3 months prior to coming to the hospital. Sustained injury to the hips, which the parents took him to a nearby clinic and he was given unknown medication, but no fractures reported. At that time, he had reduced motion in the right limb, but had no swellings, no past discharge, no increased warmth over the affected area, and no fevers. Review of other systems, cardiovascular system. He has been having a history of easy fatigability, occasional difficulty in breathing while lying flat, no palpitation, no lower limb swellings. Respiratory system, no history of cough, chest pain, noisy breathing. GIT, reported 3 loose motions for 3 days prior to admission, non-bloody, non-foul smelling, small amounts, yellowish in color, and associated with abdominal pain, which was generalized, mild pain, gradual onset, and was also associated with reduced appetite, weight loss, but no history of vomiting, oral ulcers, difficulty in swallowing, or abdominal distension. Genitourinary system, he reported of having straw-colored urine, no painful urination, no frequency, no urgency, no blood in urine, no genital discharges. In central nervous system, there is no history of any headache, fever, convulsions, no loss of consciousness, intact senses, and no photophobia. In skin, there was no history of any skin rashes prior to admission. Ear, nose, and throat, no history of nasal or ear discharge or any bleedings from extremities. Past medical history, this is third admission, admitted on December 2019. His HIE status is negative, which was tested on March 2019. At 4 years, the mother noticed the boy had been squatting while playing, and could easily get tired compared to other children at home. The mother also reports that he started on herbal medication at that time. Unknown medication, unknown herbal medication. Tetralogy of folate was diagnosed 2 years ago and was started on Lasix 20 milligrams OD, spironolactone 250 milligrams OD, carvedilol 3.125 milligrams OD, tabs-and-ephedrine 2.3 milligrams OD, and has been a cardiac outpatient who has been adhering well, who has been going to the clinic every after 2 months. Previous 2 admissions were mainly due to difficulty in breathing, fevers, and body weaknesses. In the surgical history, there is not any history of any surgical intervention, blood transfusions, major burns, or road traffic accidents. Natal and perinatal history, yet the mother attended antenatal care 4 times and had an episode of malaria infection with no major complaints, and the delivery was normal. Immunization is also up to date. The birth history, weighed 2.7 kilograms, cried immediately, breastfed immediately, no complications, and discharged after 2 days. Growth and developmental history. Child attained all developmental milestones and at the age of 10 years was doing well in the school, He's right now in P5. He's actually stopped going to school from the day he was diagnosed. He was in the hospital. Occasionally played soccer with his friends. Nutritional history: was exclusively breastfed for 6 months and introduced on other kinds of meals with time, such as soya, millet, rice, potatoes, and was tolerating the feeds well. Of recent is when he has lost appetite as compared to before. Family social history: he's a third born of 4, stays with both parents. Both parents are teachers. Currently the mother is pregnant and is in hospital taking care of the boy. Other children are alive and in good condition. No family illnesses reported. Summary: a 12-year-old male, a non-12 patient for 2 years, presented with severe right hip pain for 1 week, following a history of fall on a hip 3 months ago, and 3 episodes of loose stool, non-bloody motions for 3 days. Thank you.
Good afternoon, everyone. My name is Mpomugisha Patricia, and I'm going to take you through the general exam and the plan. So, on general exam, the patient was sick-looking, wasted, had peripheral and central cyanosis, had finger clubbing grade 4, dry mucous membranes, and was febrile to touch. Temperature was 37.4 degrees Celsius. There was no jaundice, no edema, and no lymphadenopathy. Respiratory exam: the child had mild chest injury, was tachypnic with a respiratory rate of 53 breaths per minute, was saturating at 82% at room air, had equal air entry bilaterally with transmitted breath sounds. CVS exam: he had warm extremities, capillary fill was less than 2 seconds, the pulse was 120 beats per minute, it was regular, full volume, non-collapsing. JVP was not raised, no radiofemoral delay, heart sounds 1 and 2 were heard with a pansystolic murmur at the left lower sternal border. Per abdomen, it was of normal fullness. There was a tender hepatomegaly of 6 centimeters, but no splenomegaly, no bowel sounds present. Bowel sounds were present and they were normal. CNS exam: the patient was fully conscious. GCS was 15/15. Pupils were equal and reactive to light. Neck was soft. There was no obvious focal neurology deficit or craniopathies, and Cunning's was negative. Local exam: there was marked tenderness on the right thigh, disuse atrophy of thigh muscles, no swelling. The site of pain was at the same temperature as that of the surroundings. There was no discoloration, no swelling, no calf tenderness, and the left limb was intact. Our impression was a 12-year-old male with tetralogy of Fallot in heart failure with possible acute osteomyelitis of the right hip, ruling out fracture of left hip. So our plan was to do CBC, ESR, CRP, liver function tests, and renal function tests. Also to do the X-ray and ultrasound of the hip joint. To get an orthopedic and cardiologist review. For pain management, we gave tabs ibuprofen 200 milligrams 8 hourly for 3 days, and IV ceftriaxone was given 1 gram OD for 5 days. We're to continue with anti-failure regimen medication. We put the child on oxygen therapy via nasoprongs. The patient was put in a cardiac bed and were to monitor vitals. Thank you so much.